Massachusetts is losing the battle against drug addiction. From the Berkshires to Boston, people of all ages and all walks of life are falling victim to this deadly disease.
It happens to anyone. I went to private Catholic school. It's not just low income, it's everywhere.
Grew up playing tennis competitively. I was ranked in New England and nationally.
We were playing at a club one night and a record company, noticed us, signed us, made the CD, the whole deal.
I'm the youngest. All my brothers and sisters were extremely successful. And I was always labeled as the one with the most potential.
My first drink was at age 13. After that, I shortly started using drugs and abused and used for the next 20 some odd years.
In 2008, Massachusetts spent over $2.8 billion to fight substance abuse. But the problem continues to get worse. Families are strained to the breaking point, the court system is overwhelmed, and emergency rooms are filled with the worst results of addiction. Clearly, the state's traditional solutions are not working.
I think there are many studies that show that Massachusetts and virtually every other state in the country has a inadequate amount of substance abuse services.
The way the system is now set up, a directed addiction, if you can call it a system, is as if they are pariahs and that these are moral issues.
Only 2 out of every 100 AA participants stay sober through their first 100 days. Detox facilities are a revolving door of addiction and relapse. Rearrest rates for drug users are overwhelming, and each of these failures can cost up to $23,500 per patient per year.
Inpatient or residential detoxification or rehabilitation may get people off of drugs temporarily, but it's very expensive to do it that way. And then when they're discharged into the community, a very common response is to relapse almost immediately.
When you go to detox, it's like 3 to 5 days. You're there, they put you on medication so you're not sick. You do groups and stuff, but that's it. You come out of there and that's it. There's no aftercare, there's no somewhere you can go to talk to someone. You have to do all that on your own.
Nice to meet you.
Hi, Dr. Kishore. Good to see you.
Please have a seat.
But quietly for the last 16 years, Dr. Punyamurtula Kishore and his teams of Preventive Medicine Associates have been working in over 26 communities across Massachusetts to develop a different approach to substance abuse. A smarter approach, a better approach.
I was the medical director for many programs that currently exist, and I saw some good there and some bad, some ugly. So basically, I wanted to distill what is good and bring it to an outpatient sector.
Thank you for calling Brookline Family Practice. This is Jen. Can I help you?
What makes preventative medicine different? It starts with treatment on demand. No waiting for days for a bed to open up. No calling phone number after phone number to find a facility willing to take a patient in.
You have to do treatment on demand. When the addicted person makes that first phone call, that's a big effort for them to do that.
Well, Dr. Kishore was one of the numbers that I think my pharmacist was like, if I do have one other number. I was like, just give me anyone, everyone's. And he called me back, like, immediately.
Our approach is unique because of our commitment to outpatient de-addiction, which costs thousands of dollars less and works far better than any detox available today.
In public health, we have to give the best, if not the near best treatment for a large number of people at the lowest dollar cost. So that's my goal. And to do that, we have to bring addiction to an outpatient sector.
There are people who would like a treatment provided in their home in a private setting with a certain level of confidentiality and privacy, and that kind of service hasn't really been available. And so developing that and also reducing the costs, especially in a time of economic downturn like now, it's especially important.
You get to go home, which is like the biggest deal for me and the biggest, selling point, I think, because I did not want to check into a treatment center. What was I going to tell my mother? What was I going to tell my job? It just disappear from the face of the earth. I thought it was going to be like going to jail, a treatment center.
And it's very scientifically based. We do the testing every day. So overall, for a detox in this kind of an outpatient setting for a well person, most of the costs are the outpatient visits to support the cost. So it's pretty cheap.
It's way, way more expensive, you know. It's a fraction of the cost.
By treating patients from their homes, they stay away from the toxic environment of most rehab facilities.
So, you know, you sit around the living room and one's trying to one-up you with the war stories and how they make money, and, you know, you can learn new tricks in there.
The traditional method is, you know, these people should all stay with each other, learn from each other, and get better together. But in reality, people come into treatment with various mindsets. Some people come there to beat the rap, some people because they're sick, some people because their money has run out or the drug dealer got arrested. You know, varieties of reasons, motivations people come in. So not everybody is on the same level playing field.
At Preventive Medicine, we don't coddle our patients. They're required to come to our clinics on a regular basis for treatment and drug testing.
It's an equal partnership. In a detox or rehab, they're in your turf, they're being pampered, they're taken care of, whereas here they have to put in their 50% effort.
The outpatient system also requires patients to deal with people, places, and situations in their daily lives that trigger their addictions.
So we figured out the nodal points at which people relapse, and we try to safeguard them during those nodal points. This can only be done if there is one physician or one provider or one practice, seeing them through the continuum.
At Preventive Medicine, we reject the traditional opiate replacement method of detox. We don't just wean our patients off of one addictive drug and onto another like methadone or Suboxone.
Suboxone, I think, is almost like a replacement. Suboxone, people get high off Suboxone. Suboxone is something that they take for temporary treatment, like just to get them through a couple of days so that, so they're not sick, and then they can get high when they have money.
Before I came here, though, I went on Suboxone with my primary care at the time, who didn't know anything about addiction. And so he way overprescribed me Suboxone, which I basically manipulated him into doing it. So I was getting high at the Suboxone.
Instead, we treat the individual symptoms of withdrawal with non-addictive medications.
Well, Dr. Kishore's already outsmarted them and said, well, we just won't give them one pill. We'll only give them one pill for this sleeping problem or for the chills or for the sweating. And if they don't come back, then they're done,
We treat our patients in a primary care outpatient setting in offices on the main streets and town centers of communities across Massachusetts.
Addiction used to be treated on the back wards of hospitals, mental asylums, or sort of where there are abandoned buildings. People don't want that. They want to be treated like any other person with any other illness. So all my sites are sited on the main streets of townships.
Unlike other programs, our care doesn't end when detox is over. We provide services that help the patient through all the ups and downs of recovery. This begins with sobriety maintenance, where we monitor our patients during those first few fragile weeks after detox. Since this is also handled in an outpatient primary care setting, it costs nothing more than the price of a routine doctor's visit and drug test. Sobriety maintenance is followed by sobriety enhancement, where we help integrate our patients back into mainstream society and deal with life's challenges substance-free.
We bring the families together, we have meetings, we figure out if the person is not in the right job, we send them to Mass Rehab for a second look at where the person can fit in the national economy.
Our team is committed to treating the whole patient and addressing the root causes and effects of each patient's addiction. Whether it be primary care treatment, mental health services through our neuroscience center, job placement, or group meetings and counseling, no other program available today offers the continuum of care provided by our team. Our doctors, nurses, psychiatrists, and social workers tailor treatment plans for each patient based on their unique needs and circumstances and remain in constant contact with one another throughout the recovery process.
It really fits into what is the principles of good primary care. Good primary care is availability, which Kishore is always available, access, easy access without barriers, comprehensiveness, but continuity is all important. The primary care practitioner, and that for the addicted individual, needs to have this wraparound over time.
He addresses the entire individual from head to toe in terms of physical, mental, spiritual, all aspects. because all of them need to be addressed for this to work. You can't have one without the other.
So what can preventative medicine be doing for Massachusetts? Simply put, our outpatient primary care system costs less and works better than any other program in existence today. We can lower costs for state-free care reimbursements. We can work with police, probation, sheriffs, and the courts to help people in your care achieve sustained recoveries. And we can reduce your caseloads and save your agencies significant money in the process.
It's a matter of funding the public health dimension of the care of the addicted population.
If we do good teamwork, I think everybody benefits. So that's what our philosophy is, to work hand in glove with probation, parole, and the criminal justice system or the legal system.
I would like to go and talk to the probation officers there and just tell them about this place, because it could save so many other people out there from being in jail, and then the state pays for them while they're in jail.
As Massachusetts continues to battle against drug addiction, we hope to be working right by your side. With over 26 preventive medicine offices across the state, there is truly no community in Massachusetts that we cannot or do not serve. We have the staff, know-how, and dedication to partner with officials across Massachusetts to find meaningful and cost-effective solutions to this growing epidemic.
Dr. Kishore, everyone, all the doctors, they're really involved. They really actually care about what they're doing. They're here for a reason.
This is definitely the best experience I've had with anybody in the addiction field.
In my opinion, it doesn't work unless they're willing and able. And as long as they are both willing and able, and they follow the suggestions, it works. Because I'm sitting here today.
Preventative medicine, a better way, a smarter way.